Pongan mucho cuidado, mis amores, para todas aquellas personas que me escriben al interno que les repita la receta para los problemas de azúcar en la sangre. Vamos al grano. 15 clavos de olor, 2 estillas o ramas de canela así de grandes como este dedo y así de gruesitas, una botella de agua mineral personal. Se consigue en un tarrito o ahí mismo en la misma botella, le van a poner los 15 clavos de olor y le van a meter las 2 estillas de canela. Ustedes dejan fermentar esto en la parte de refrigeración en su nevera durante toda la noche. Al otro día, en las mañanas, en ayunas, se van a tomar 3 cucharadas así de grandes. Al almuerzo 3 cucharadas grandes y a la comida 3 cucharadas grandes. Si no lo quiere hacer en cuchara, lo puede hacer con un vaso, un pocillo o una copita así de grande. Los 3 golpes todos los días durante 15 días. Descansan una semana. Primero tienen que hacerlo durante 15 días. Descansan una semana y vuelven y comienzan. Vayan donde su médico que les haga el examen. Mire, esto es bendito. Testimonios reales de cantidad de personas que de verdad están gozando de una salud súper maravillosa. Espero que lo pongan en práctica. No sé.
Hello everyone, today we will analyze a viral video that claims a mixture of cloves, cinnamon and water that helps control diabetes. This type of content is very common on social media and is often presented as a simple and natural solution for a serious health problem.
Many people believe this recommendation because they are easy to follow and are usually supported by personal experience. However, personal experience not always reflects scientific evidence, and their information should be relied carefully.
Diabetes is a chronic disease that affects millions of people around the world. Because it can cause serious complications, it is important that treatments and recommendations are based on scientific evidence and medical supervision.
In this video, we'll examine the claims made in the very post, compare them with current medical knowledge, and discuss whether it's primarily truly effective and safe for people living in the streets.
Colleagues, the video we are analyzing claims that a mixture of cloves, cinnamon and water can help control blood sugar levels. However, this cannot be considered as a valid medical treatment because diabetes requires proper diagnosis, continuous monitoring, and evidence-based management. According to the American Diabetes Association, diabetes care should be based on a healthy diet, regular physical activity, medical supervision, and medications when necessary. There is currently insufficient scientific evidence to support this recipe as an effective treatment. Another important issue is that the video promotes the same remedy for everyone, without distinguishing between different conditions such as type 1 diabetes, type 2 diabetes, pre-diabetes, or gestational diabetes. Each of these requires a specific clinical approach. For example, in type 1 diabetes, the body does not produce enough insulin, so patients require insulin therapy to survive. A drink made from cinnamon and cloves cannot replace this essential treatment. If insulin is discontinued, it may lead to severe complications, such as diabetes ketoacidosis, which is a medical emergency. It is also important to highlight that diabetes is a metabolic disease characterized by elevated blood glucose levels and if not properly controlled. It can affect the eyes, the kidneys, nerves, heart, and blood vessels. Therefore, any claim suggesting a universal natural cure is misleading and potentially dangerous.
In addition, the video relies heavily on personal testimonials for to support the claims. However, testimonials are not scientific evidences Medical recommendation must be based on the clinical studies involved to rank populations, control continuums, and review the evaluation of the both effectiveness and safety. Unsafe glucose recurring of analytical experiments is not enough to prove that the treatment works. The video also suggests an specific drug dosage using to the mixture for 15 days but stop it for a week. But it's due to science and clinical studies supporting the regimen. Medicines dosage reduction must always evaluate those results that evaluate benefits, risks, and possible adverse effects. Scientific evidence of animal has been studied by systematic reviews, including for the from Cambridge, conclude that the current date is insufficient to recommend days. Cinnamon also dates for diabetics. Some studies show only moderate reduction and fasting blood glucose with a symptom important in the glycemic hemoglobin or HbA1c, which is a key indication for a long-term glucose control. Additional, discontinuous respiratory transmit is a foreign abortive recommendation can be extremely dangerous. It may lead to complications such as hypoglycemia, especially if patients have already taken medication like insulin or another antidiabetic drugs. Hypoglycemia causes varying tremors, confusion, loss of concentration, and even seizure and severe case.
Regarding clubs, the video presents them as part of a special remedy, but no current medical guidelines recommend the clove-infused water as a treatment for diabetes. Cloves contain eugenol, a compound studied mainly in laboratory settings. However, laboratory findings do not automatically translate into effective or safe treatments for humans. It is also important to remember that natural does not always mean safe, but cinnamon and cloves contain biologically active compounds that can affect the body. For example, some types of cinnamon contain cornmeal, which may cause liver toxicity when consumed in high amounts, particularly in scientific individuals. The video also uses terms such as fermentation, but in reality, the preparation is simply soaking spices in water, with no scientific evidence showing that this process improves blood glucose control. Furthermore, homemade preparations may carry contamination risks if not properly handled. Another major concern is that patients may abandon their prescribed treatments after watching such videos. The World Health Organization warns that poorly controlled diabetes can lead to blindness, kidney failure, cardiovascular disease, and amputations.
Likewise, for type 2 diabetes, we cannot think that a simple drink is enough. Treatment depends on what each patient needs. It usually includes changes in lifestyle and medications like metformin or other antibiotic drugs. There is no scientific guideline that tells patients to replace these treatments with cinnamon or cloves. Various medical books, like Harrison's Principle of Internal Medicine, explains that diabetes is a long-term disease that needs proper medical care, and other books shows how important it is to use therapies that are proved by science. Another main point is that the video does not see the difference between lab tests and real evidence-based fastings. Some compounds like eugenol shows good results in vitro, but that does not mean that they work in the same way in humans. In conclusion, viral videos like this only spread wrong ideas among people. They can make patients stop following safe, proof treatments. Currently, guidelines from the American Diabetes Association, medical reviews, and other experiments are clear. Cinnamon and cloves are not replaced for medical therapy. Our final advice is that patients must not stop taking their prescribed medications. They should avoid treating themselves based on viral videos, and they should always
difficult to